Ruth, why don't you talk about the labor shortage in the childcare industry? I mean, it's acute, right? I mean, we have labor shortages across many sectors, and tell us a little bit about why that is and maybe how it can be solved.
Sure, good question. So one thing that we do in Wisconsin is we do periodic workforce studies of people who do work in early care and education. And what we know is that 5 years ago, we had a 40% turnover rate in this field. That was 5 years ago. Since then, we've seen COVID, we've seen worsening working conditions for people who work in early care and education, requirements early on in COVID to keep their programs open when school districts were closing their buildings. And what we know out of the last workforce study is that this workforce is highly educated, so over 80% of them have education outside of high school. Over 55% of them have at least an associate's degree or a bachelor's degree. For family child care programs, those operating programs out of their homes, the average take-home pay after expenses is about $7.40 an hour, so almost minimum wage. And for those who are working in child care centers, it's about $12 to $13, depending on which market you're in. If you're in rural markets, it's considerably lower than that. Urban markets, slightly higher. People who work in this field stay in this field for a long time, despite the fact that they have poverty-level wages. Over 35% of them rely on public assistance. 25% of classroom teachers in child care programs have food insecurity within their own homes as a result of working in low wages. And it's not surprising with those conditions at a time when we see other industries able to raise their wages. We're competing with Quick Trips, with Amazon Distribution Center in Milwaukee that pays $20 an hour with a $3,000 signing bonus. It is not surprising that 75% of child care programs in Wisconsin are in the process of trying to hire people. And if they can't hire people, they have to close classrooms, they have to increase wait lists, they have to reduce hours of operation. So this is a real tenacious workforce. They stick around, they're resilient, but at some point, we hit a breaking point with that in terms of what we're asking for them.
What would be the level of pay that would, boost the child care workforce?
Care for an infant in Wisconsin hovers around $12,000 a year, which is not enough to end up paying for the cost of that care in a child care program. The true cost of care needs to be enough to actually compensate the teachers at the level that is commensurate with their education. Our association pushes to move compensation towards parity with our K-12 schools based on education levels. We're not saying that someone who doesn't have a bachelor's degree should get paid comparably with someone with a bachelor's degree. We're simply saying acknowledge the fact that these are educated individuals. So with an associate's degree, we would want to see at least $21 to $23 an hour, and then moving up from there to the bachelor's degree level. And I think the other big piece to keep in mind is the need for benefits. Only 20% of people that work in childcare receive and participate in an employer-sponsored health care plan because they're expensive and there's just not enough revenue coming in to take care of those expenses.